Heat can impact our health in a number of ways. When it's hot, our bodies are under a lot of distress. Prolonged exposure to high temperatures is associated with increased hospital admissions for cardiovascular, kidney, and respiratory disorders. And excessive heat can increase adverse birth outcomes. Elevated heat, especially along with high humidity, makes it difficult for the body to cool itself. Think about it. If it's both hot and humid outside, which it definitely is where I am right outside of Washington, D.C., your body actually loses some of its ability to cool itself down because your sweat can't evaporate if the air is already saturated with water. By the end of the century, heat-related deaths are projected to increase on the order of thousands to tens of thousands each year. Scores of US cities, home to tens of millions of people, will face dramatic increases in dangerous and extreme heat days by the middle of this century if current greenhouse gas emissions trends continue. And it's not always the cities you think of. Look at number 5 on the list, Burlington, Vermont, and number 7, Helena, Montana. Maybe not places you think of as hot, but certainly places that are heating up relative to the temperatures that they're used to. And extreme heat days early in the season come with higher mortality risks, as people's bodies have not adjusted to the seasonal temperature shift. Our ability to work also declines with heat, particularly for those who work outside. And while this is both an urban and rural issue, think construction and agriculture, there is a racial disparity that impacts of outdoor work. More than 40% of outdoor workers identified as either Black or African American or Hispanic or Latino, despite comprising about 32% of the general population. To round out heat impacts, I wanted to further emphasize health vulnerabilities people can experience during a heat wave. I'm going to walk through another infographic from the 2019 Lancet Countdown US Brief that illustrates how people can be differentially impacted by a heat wave. You can see their unique vulnerabilities, as well as suggestions for adaptation to address them, which is one type of solution that we'll cover later. In this example, we have a young Black girl who is at key risk for an asthma attack from air pollution. She is susceptible to heat because she is a child and she has asthma. She is a person of color and lives by sources of air pollution, and she has inadequate health insurance. She does end up visiting the emergency department for an asthma attack. And adaptation actions that could help situations like Sasha's include real-time air monitoring that send warnings to groups who may be vulnerable to this exposure. In this example, we see an older Asian man. He is at risk for heat-related heart failure. He is particularly susceptible because he's older, he has a heart condition, and is on medication that increases his sensitivity to heat. Many different types of medications can impact a person's ability to regulate their body temperature. He is also a person of color, has a room on the top floor of his nursing home, and the nursing home doesn't have great air conditioning. He also has limited mobility, and he does end up in the hospital for an extended stay due to heart failure. Adaptation actions that could help situations like Young's include the nursing home implementing heat emergency protocols and investing in air conditioning. Next up is air quality impacts, including fossil fuel pollution. We've said this before, but it's worth reiterating. The root cause of climate change is burning fossil fuels for energy. Burning fossil fuels also creates lots of air pollution, and climate change worsens air pollution. This creates a negative and accelerating feedback loop. Hazardous emissions from coal-fired power plants contribute to cancer, lung disease, and respiratory illness, which has a huge cost. One estimate is $187.5 billion in public health costs per year in the US. A lot of times we hear about how much it will cost to implement climate solutions, but we can see how much it costs to burn fossil fuels. Fire season in the American West is an average 105 days longer than it was in the 70s, and the most devastating fires have occurred in just the last 10 years. Particulate matter increases during wildfires, which can aggravate existing respiratory conditions. Smoke can also travel a long distance, creating dangerous conditions far from the immediate source of the flames. Smoke from wildfires out west in California and Oregon has traveled thousands of miles east, impairing air quality on the East Coast from Washington, D.C. to New York. And anxiety, constant worrying, trouble sleeping, and other depression-like symptoms are common responses before, during, and after wildfires. Allergenic pollen seasons last 20 days longer than 30 years ago, and pollen concentrations are up more than 20% across North America. This is definitely true where I live, and I personally have had more severe reactions to high pollen days and have definitely noticed the longer allergy seasons as I tear up when I go outside. Air pollution also disproportionately impacts certain populations. Children who grow up in more polluted areas face the increased risk of having underdeveloped lungs, which may never recover to their full capacity. The average drop in lung function was 20% below what was expected for the child's age, similar to the impact of growing up in a home with parents who smoked. So living near air pollution is like living in a house with parents who smoke, and we know the harms there. Hispanic children are twice as likely to die from asthma as compared to non-Hispanic whites, and 1 in 2 Latinos in the US live in counties that frequently violate air quality standards due to the combustion of fossil fuels. Black children are 4 times as likely to die from asthma as white children, and Black adults are 3 times as likely to die from asthma-related causes than whites. African-American women have the highest rate of asthma, and more African-American women have died from asthma than any other group. This slide emphasizes the importance of climate solutions that create healthier air for us to breathe, and also brings to light the importance of one of the social determinants of health that we covered earlier, access to care. The healthcare sector specifically is recognizing its role in treating climate-induced health outcomes, and they are also taking steps to reduce their own carbon footprint to prevent these diseases in the first place. I'll talk more about that in our chapter on solutions. Moving on to hurricanes and heavy rain. The picture on the slide is from Hurricane Harvey in Houston in 2017. The resulting floods inundated hundreds of thousands of homes, displaced more than 30,000 people, and prompted more than 17,000 rescues. In addition to the flooding that you see in the photo, the floodwaters that swirled through many of Houston's streets contained arsenic, lead, and dangerously high levels of the bacteria E. coli, among other agents. Houston is also a heavily industrialized area. Over a 13-county area, 46 chemical plants and refinery sites released a reported 4.6 million pounds of so-called excess emissions, above and beyond normal operations. Some of this was due to necessary shutdown or startup procedures, and others due to unforeseen leaks or explosions. Dampness, which can persist for weeks or months, even after a minor flood, provides a nearly optimal breeding ground for mold. In the wake of hurricanes Katrina and Rita of 2005, for example, heavy mold growth was identified in 70,000 water-damaged homes. Studies show that infants and children, particularly those of lower socioeconomic status, who are exposed to mold before 1 year of age, are 2.8 to 4 times more likely to develop asthma than their unexposed peers. This infographic is from a 2021 report, which led with the finding that health costs from climate change and fossil fuel pollution tops $820 billion a year. Medical treatment and recovery from the many types of health problems worsened by climate change is expensive and burdens patients, employers, the public and private insurers, and health system operators. Extreme weather events commonly require people to seek medical care in emergency rooms, hospitals, and non-emergency healthcare settings. When patients are admitted to hospitals to treat severe illness and injury, they may also forego income at work, triggering hardships for themselves and their families. The cost can continue to add up once patients are discharged from hospitals because of the possible need for ongoing outpatient care and medications. Please note that these are just the health costs of inaction. There are further costs related to infrastructure, for example. Drought patterns and trends have been changing over the last several decades, and they vary regionally across the country. Droughts in the Southwest are projected to become more intense. And drought is also increasing the risk of wildfires, the effects of which we just discussed. Dry soil increases the number of particulates that are suspended in the air, which then irritate the bronchial passages and lungs and increase the risk for acute respiratory infection like bronchitis. The dry, dusty conditions associated with drought also can lead to infectious disease like valley fever, which causes a range of symptoms, including fever, chest pain, coughing, rash, and muscle aches. Contaminants in the groundwater also become more concentrated with less water available to dilute them. Additionally, drought can lead to higher than normal levels of toxins in fish, as low water levels can result in an increase in the concentration of toxic chemicals and toxic algae in bodies of water. Across most of the United States, climate change is expected to affect fresh and marine water resources in ways that will increase people's exposure to water-related contaminants that cause illness. Water-related illnesses include waterborne diseases caused by pathogens, such as bacteria, viruses, and protozoa. Water-related illnesses are also caused by toxins produced by certain harmful algae and cyanobacteria, and by chemicals introduced into the environment by human activities, all of which we just talked about. Climate change has expanded habitat ranges, reproductive rates, and metabolism for vectors such as mosquitoes and ticks that can carry pathogens. These are bugs that carry diseases, and we're seeing them in new places and at higher numbers. The number of illnesses caused by mosquito, tick, and flea bites have tripled in the United States over the last few years. Mosquitoes are one of the most prominent carriers for tropical diseases, and more than 20 major US cities have ideal climate conditions for mosquitoes at least 200 days each year, so most of the year. The Aedes aegypti mosquito is the principal vector that spreads dengue fever, chikungunya, Zika fever, and yellow fever. We're also seeing cases of Lyme disease increasing. Lyme disease carrying ticks are now found in half of all US counties. This marks an almost 50% increase in the number of counties that have recorded the presence of these ticks since the previous was recorded in 1998. Since the late 1990s, the number of counties in the northeastern United States that are considered high risk for Lyme disease has increased by more than 320%. The tick is now established in areas where it was absent 20 years ago, which may make disease carried by ticks harder to identify in areas that haven't seen them before. A delay in diagnosis can make the disease worse. Increasing concentrations of carbon dioxide can actually impact the nutritional quality of our food. Protein content of major food crops is very likely to decline significantly, as much as 10% as atmospheric carbon dioxide concentrations increase. Another important element of nutrition is how much food will actually be available. For example, by the end of the century, US corn yields could fall by a third from heat stress alone. The number of extreme climate-related disasters, including extreme heat, droughts, floods, and storms, has doubled since the early 1990s. These disasters harm the agricultural productivity of wheat, rice, and maize, causing food price hikes and income losses that reduce people's access to food. Continuing on with food insecurity, globally, an estimated 821 million people are currently undernourished. Climate change impacts vary among diverse social groups depending on age, ethnicity, gender, wealth, and class. Climate extremes have immediate and long-term impacts on livelihoods of poor and vulnerable communities, contributing to greater risks of food insecurity that can be a stress multiplier for internal and external migration. Food security will be increasingly affected by projected future climate change. And all of the physical health impacts of climate change interconnect with mental health. Immediate and long-term impacts of climate change on the environment, society, and infrastructure can lead to trauma, shock, stress, anxiety, and depression. Also, not all Americans are affected equally. There are certain vulnerabilities that exacerbate mental health impacts. People can experience acute and chronic impacts from climate change, including trauma and shock, aggression and violence, compounded stress and the impact of that stress on physical health, strains on social relationships, and as we discussed earlier, the efficacy of medication that is used to treat mental health disorders. People also experience post-traumatic stress after disasters, loss of autonomy and a sense of control, eco-anxiety, and the loss of personal or occupational identity when climate change threatens their workplace. Youth are also very angry at systems in place that have not changed or made significant policy advancements. But becoming part of the climate movement is a way to channel that anger, and being part of the solution can improve mental health. Finally, mental health impacts on society. In addition to the effects on individual health and well-being, climate change affects how individuals interact in communities and relate to each other. For example, natural disasters can have a negative impact on community bonds. A changing climate will likely affect aspects of community well-being, including social cohesion, aggression, and social relationships. Individuals and groups displaced by climate-related events can separate communities, social networks, and systems that provide important emotional resources. However, communities with higher levels of social capital and community leadership recover the quickest after a disaster. Heightened anxiety and uncertainty about one's own future can reduce the ability to focus on the needs of others, negatively impacting social relationships with friends and coworkers, as well as attitudes towards other people in general. Interpersonal violence may rise due to warmer global temperatures and reduced access to green spaces. Domestic violence and alcohol abuse have also been shown to rise after floods. Intergroup aggression is also heightened. Violence increases as there is competition for resources. Intergroup attitudes may also be negatively impacted by climate change, causing hostility towards others outside one's social group. And finally, but critically, cultural and religious ties to the land have been disrupted for Indigenous populations by our changing climate.